To be able to treat the couples properly, it is very important that we lay emphasis on the right diagnosis for female as well as male causes. The diagnosis or the investigation of female infertility is very simple. It starts with simple blood test which will assess the hormonal parameters in the woman. So we try to assess her functioning of the thyroids, her prolactin levels, her ovarian reserve tests are also done. So now we do on the second and the third day, we do certain blood tests which are mainly the hormones which are coming from the brain and stimulating the ovaries to produce the egg. So this includes the follicle stimulating hormone, the luteinizing hormone and the serum estradiol assessment. We do these tests which tell us about the reserve of the ovaries in the woman. Now there is another test which is called as anti-Mullerian hormone. This is a newer sensitive test which has been diagnosed, and it can be done at any point of time in the woman's menstrual cycle. So therefore there is no bias or no restriction to do it on the second or the third day. So these tests, once they are done, they help us in not only assessing the hormonal parameters in the woman, it also helps us in assessing the ovarian reserve. That is the number of eggs or the potential number of eggs that the woman will have, which has a huge impact on her fertility. We further do an ultrasound to see the uterus, the tubes, which are generally not visible, but whenever they are diseased and swollen with water or with some infection which leads to the formation of hydrosalpinx, they will be visible on ultrasounds. We also try and see the ovaries and see what are the number of follicles or small unmature egg or mature egg that can be seen in the ovaries. So this is also a very important tool to assess the entire pelvic anatomy, wherein in just one simple glance we are able to assess the whole thing in a very comprehensive manner. As we investigate further, we have to do tests for the tubal patency. So simplest time-tested age-old test for tubal patency is the HSG or the hysterosalpingography. Here what we do is that we push in a dye inside the uterus and and then take repeated X-rays. As the dye will travel from the uterus inside the tubes and then spill out from the tubes, we are able to assess and track this passage of dye and see if these tubes are open. It is very important to understand that tubes are very, very fine structure, and therefore normal tubes are generally not seen to the naked eye or not even visualized on ultrasound. So this test becomes very important, wherein we have not been able to find any other cause in the women. There can be an advanced testing further as well. Whenever we find any problem in the tubes or uterus or the ovaries, we need to even correct them. And sometimes when we don't find any cause and we need to investigate further, then we do a laparoscopy or a hysteroscopy. So laparoscopy is an endoscopic procedure wherein we put in very fine instruments, endoscopic instruments inside the abdomen of the woman and with a camera, and then we try and see the whole pelvic anatomy in real time. So this is a direct tool for assessing the uterine and the tubal and ovarian status.